Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon. I'm very pleased you could be with us for this next and third segment for today. Facial rejuvenation. One of the most common requests I hear about in my office is a person who comes in and wants their face to be rejuvenated. They might want to look younger. They want to appear more vibrant. In general terms, facial rejuvenation. That's one of the most common requests I see in my practice as a plastic surgeon. Probably second is breast surgery, and then third is body recontouring. But facial rejuvenation really, I think, is the number one topic and number one request that I receive in the office. So how do we go about assessing a patient and determining what's best for their facial rejuvenation? I like to begin in the office with asking a patient what they want. What would they change about their appearance? And what areas are they concerned with? First of all, it's normal human nature. It's actually healthy human nature for someone to want to look their best. I think everyone wants to look their best. It's a normal part of human nature, as I said. When we see someone on the street who is not concerned about their appearance, we recognize that as being out of kilter, somewhat odd, unusual, perhaps even ill. So it's normal human nature to want to look your best. And in fact, our species, Homo sapiens, we have been changing our appearance for thousands of years. Scarification, enlarging certain body parts such as the earlobe, trying to keep other body parts small, lengthening parts of the body like the neck, keeping the feet small, doing tattooing, piercing, scarification in certain patterns, etc. So this has been going on in our species for thousands of years. It seems to be actually part of our human nature. So how do we start in the office? First of all, I want to hear from a person, what is it that you see? What is it that you would like to change about yourself? What part of your face would you want to improve or change? At that point, I like to look at their photos together, or we can look at that person together in the mirror. We also are fortunate enough now to have a very sophisticated piece of technology in my office. We're introducing this to the Monterey Peninsula. It's called the Vectra System. Essentially, it's 6 cameras that are processed through a computer. It's fairly sophisticated with software, this program. 6 cameras and a computer that allows us to view someone in 3 dimensions. It has a face module, it has a breast module, and it has a body module. So in that way, a person can stand in front of it. It's like having your picture taken, but it's 6 cameras, a fairly sophisticated system. And then the software processes this, and we can sit down together at the computer screen, and the patient can point out to me what they would want to affect, and then we can actually do some sort of mimicking or simulating, giving someone an idea of what a neck lift might be like, and what if we do some laser resurfacing, what if we do some blepharoplasty or eyelid surgery, how can we change? And it's a great way, I think, that the patient can communicate to me in different terms and in improved terms what they see and what they would like to change. Now, it's certainly not a guarantee of a surgical result in any way, but it is, I think, a great communication and planning tool. It's called the Vectra photographic system. So we can look at a person's pictures, we can look at the Vectra, and we can look together in the mirror, focusing on what that particular person, that patient, customer, or client, however you'd like to, whatever term you'd like to use, what they are concerned with. Following that, I'm happy if a patient would like to hear my input. I can do a facial analysis. I like to start from the top and go down. I start with the forehead and then go to the eyebrows, and then go to the upper lids, the lower lids, the upper cheeks, the nasolabial fold area, and then the lower third of the face. I'd like to break up, or I like to look at the face in thirds. I look at the upper third of the face, the middle third, and then the lower third. Essentially is the jowls and the neck. So we can look at a person together and go through treatments We can start with non-invasive treatments, we can do minimally invasive treatments, and then we can talk about surgical procedures, of course. And in my office, it's like a la carte menu at a restaurant. You can have nothing, you can have one thing, you can have 10 things, you can have 5 things, and we'll just go through step by step. I think in general, it's all a basic part of human nature, but there are subsets of personalities. Some people come to me and they'll want everything done in one day, in one sitting, in one trip to the operating room, anything that can be done to their face or that we decide to do, just because they want to have everything accomplished and they want one recovery period. Other times, people will say, you know, this year let's do the eyelids. Next year I'll consider having the neck done, etc. So I'm not judgmental about it, but we go through the pros and cons of different approaches. So once we do that, once we look at photographs or look in the mirror together or look at the Vectra, I usually start by assessing the skin. Everyone who lives in California probably lives here or comes here because of the outdoor living and because they love the weather in part. However, sun damage really is the enemy of youthful, healthy skin, healthy appearing and vibrant skin. Unfortunately, the sun feels so great, but really it brings upon something called dermal elastosis, which is a change that we can see clinically, in other words, by looking at someone, and we can actually do little mini skin biopsies to show differences under the microscope of what happens to the collagen and to the melanin and to the orderliness of the collagen layers, etc. So that solar and dermal elastosis really is an effect of long-term skin. So I always like to assess people's skin, and I'm a big believer in having people get on a good skincare program, avoiding sun, avoiding smoking, learning how to properly moisturize and cleanse their skin, and then we can talk about increasing the cell turnover with regeneration and exfoliation. That's when we encourage the very outer keratin layer and the very top cells to turn over or be shed more rapidly. And I always tell people, keep in mind that a new baby cell from the germinal matrix, where the cells are created and grow, that factory, it takes a minimum of 30 days for that cell to come to the top. So people have to hang in there with skincare products and how to take care and learning how to take care of their skin for a minimum of 30 days, even before you might notice any type of difference. So I do a skin evaluation, and we can talk about how best to take care of their skin. I might recommend certain products. I might send a patient to the esthetician, etc. And then, of course, just to treat the skin, we can talk about skincare and chemical peels. That's when we apply things. We can talk about laser. We can talk about dermabrasion, which is essentially resurfacing by sanding. That works really well for the perioral lines. Some women call them lipstick lines, smoker's lines, even though they don't smoke. So I think a facial analysis starts off with skin. Following that, we can talk about minimally invasive things like Botox, which is a muscle relaxant. We can talk about fillers. We can talk about fat transfer. The reason why we talk about fat transfer and fillers and things like that is because as we grow older, we tend to lose fat in our face and lose volume in our hands and gain weight in our trunk. It's kind of a double whammy there. So as we mature, we lose fat in our face, we lose fat in our hands, and we gain weight in our trunk. So that has effects on the volume of the face. So at certain times, I'll recommend that a patient consider fillers, which is an injectable. It comes in a sterile syringe, and we attach a needle and do that in the office by injection. Fat grafting is a way where we harvest cells, typically from the abdomen or the flanks, with a very conservative amount of liposuction. We process the fat, clean it, etc., process it, purify it, and then re-inject it to certain areas, a certain area that needs more volume. So that's fillers and fat. Now, Botox, as I mentioned, is a way to introduce a muscle relaxant. I think it's great for the upper third of the face. I tend to be very conservative, ultra conservative in the lower third of the face. It's a muscle relaxant. So what that does is prevent the muscles underneath the skin from contracting. So we can soften furrows, soften fine lines, and we can also do some conservative reshaping of areas like the brows. Well, how do we do some brow shaping? what I can do with Botox in the office is a micro Botox brow lift. So to summarize, there are certain depressors of the brow, three muscles, the procerus, the corrugator, and the orbicularis. There's an elevator of the brow, the frontalis. So if I selectively get the depressors to relax, and I let the elevator take over, we can shape the brow to a certain degree. The ideal female form in the eyebrow has a little peak laterally. So more common in females than in males, we like to elevate the lateral part of the brow. So then, I start by looking at the forehead, the brows. There are many types of ways surgically and with procedures that I can affect the position of the brows and the shape of the brows. Then I go to looking at the upper lids, blepharoplasty, and then the lower lids. This is one of the most powerful procedures that we can offer in plastic surgery, to do an eyelid tuck or blepharoplasty. For the upper lid, I look at the amount of extra skin. Of course, I look at the brow because the brow is the roof of the upper lid. For the lower lid, I look at the upper cheek because the upper cheek is the foundation for the lower lid. So for the upper lid, I look at the amount of skin. I look at the sort of chronic puffiness. I can look at the fat compartments. And we can mold and shape and tailor that upper periorbital area very effectively to give people relief from what they might say they have a tired look, or chronically puffy eyes, or sort of tired or aging eyes. It can be very powerful. For the lower lid, oftentimes people will come in and tell me that they have lots of extra skin. That's rare. They might have a very minimal amount of extra skin, but primarily it's the fat pouches. It's the fat that lubricates and cushions the globe that starts to push through the septum. That's the membrane that holds it in place. That septum can become weak, and we need to shore that up, remove some fat, reposition fat, sculpt and tailor again to give a more youthful or vibrant look to the lower lids. I will oftentimes recommend shoring up or repairing the canthal mechanism, which is the support mechanism that helps us keep the lower eyelid in place. That's called a canthoplasty. Then I go to the malar area, that all-important area that we want to be full and properly positioned. All the glamour models, if you flip through a glamour magazine or see the celebrities, they all have well-defined high, what we call cheekbones. That arc of beauty, starting from the lateral brow around the periorbita to the cheekbone, that needs to be full and prominent and youthful. Following that, I go to the cheek itself. We need to look at volume. I think the older way we would do facelifting is to pull on the so-called extra skin, remove the extra skin, excuse me, and then tighten up. I think that oftentimes would result in a sort of a less defined, flatter face. So what I tend to recommend, what I tend to recommend now is a more of a volumetric rejuvenation, where we look at the volume that's lost. We can do fat grafting or fillers. We can reposition the fat compartments, reposition the tissue. Yes, remove some skin, but mostly repositioning and increasing the volume to do volumetric restoration. Finally, or thirdly, I look at the lower third of the face, the jowl area. I think for men and women, it's very desirable to have a sculpted, clean, crisp jawline. And then I look at the neck to consider, is there extra skin? Is there extra fat? Are the muscles loose? Some people come in and they point to what they say they think is so much extra skin, or they say they want to get rid of the gobbler neck, or they feel that they have these bands of skin. It's actually the platysma muscle. The platysma muscle in our species runs from the mandible, that's the jaw, down to the clavicles, and it really is vestigial, in other words, like the appendix. It has no other function other than to provide the plastic surgeon with some opportunity for work. So oftentimes the platysma can get lax, and we can tighten that up with something called a platysmoplasty. So again, step by step, when I see someone in the office, I want to know what they want to change. Then we can look together with the Vectra, very sophisticated computerized 6-camera system. We can look at their photographs. We look in a mirror together. I start with the skin. We can go through a good skincare regimen for them. We can think about skin rejuvenation and resurfacing with different modalities such as chemical peels, estheticians and facials or laser. I look at Botox use. I look at fillers and fat. And then we get to procedures that are surgical. And we can go, excuse me, top to bottom. Forehead, brows, eyelids, the mid-face, and then the lower third of the face, the jowls and the cheeks, and jowls and the neck. Once again, if you would like more information about facial rejuvenation or any type of plastic surgery, or you're interested in improving your appearance, I'm Dr. David Morwood, drmorwood.com, DRMORWOOD, or 646-8661. That's 831-646-8661. We'd be delighted to see you. Once again, I'm Dr. David Morwood. I am a board-certified plastic surgeon. This is Your Health television program. Thanks very much for joining us.